Hey everyone, and welcome. Today we're taking this incredible journey deep inside the human body. We're going to explore one of biology's most amazing feats of engineering, how a hard, solid bone can completely repair itself after a major break. All right, let's get right into it. I mean, have you ever really stopped to think about it? It's not like you can just slap some glue on the pieces and call it a day. So what's the secret? How does our body take two totally separate, broken bits of bone and somehow weld them back into one single strong structure? Well, that's exactly the mystery we're going to unravel today. So, first things first, we've got to understand the material we're working with. And that all starts with the blueprint for our entire body, the skeleton. And believe me, it is way more complex and dynamic than you might think. So, an adult human skeleton? It's a marvel. It's made up of 206 different bones, and every single one is perfectly shaped for a specific job. From the huge weight-bearing bones in our legs to the teeny tiny, delicate bones inside our ears. And we can basically divide this whole framework into two main parts. First, you've got the axial skeleton. That's your core. Think skull, your spine, your ribs. Then you have the appendicular skeleton. That's everything else, your arms, legs, shoulders, pelvis, all the parts that let us move around and interact with the world. And this right here is probably the most important thing to get from this section. Your bones are not just some static, lifeless scaffolding. No way. They are living, breathing organs, just bustling with cells, fed by blood vessels, and they are constantly actively changing. This living nature is the absolute key to their incredible power to heal. Okay, so let's meet the microscopic construction team that's on the job 24/7, keeping this whole living framework in tip-top shape. These guys are seriously the unsung heroes of our skeletal system. So what's going on here is this constant balancing act. On one side, you have your osteoblasts. These are the builders. Their job is to lay down new bone tissue. And on the other side, you've got osteoclasts. Think of them as the demolition crew. They break down and clear away old bone. This constant dance of building up and breaking down is what keeps our bones so strong and healthy. And this process isn't just for tiny touch-ups. Get this. Because of that maintenance crew, your entire skeleton completely replaces itself about once every decade. That means the bones you have right now are not the same exact bones you had 10 years ago. How wild is that? So, what happens when this perfectly maintained structure is suddenly hit with a force it just can't handle? Well, that's a crisis, the break. And the body triggers an immediate and incredibly powerful response. The second a bone fractures, your body sounds all the alarms. There's intense pain, of course, immediate swelling as the area just floods with fluids, and often you can actually see a deformity. You totally lose the ability to use that part of your body, and sometimes you might even hear this weird crackling sound called crepitus. And that break kicks off this brilliant four-step healing process. First, a blood clot called a hematoma forms to stop the bleeding. Then, the body creates something called a soft callus. It's kind of like a natural internal splint. Third, that soft patch starts to harden as minerals are laid down. That's calcification. And finally, over months, the bone is remodeled back to its original shape and strength. Now check out the timeline here. The emergency response and the callus, that all happens pretty fast, within hours and days. The bone gets hard and feels pretty much healed in about 6 weeks. But look at that last stage, the remodeling. That final polish, getting the bone back to its full original strength, that can take up to a whole year. So the body's natural healing process is amazing, right? But it's not always enough. To make sure the bone heals in the perfect position, we often need to call in some medical backup. The very first thing a doctor has to do is something called reduction. And really, that's just a fancy word for getting the broken pieces of the bone lined up again, back in their proper alignment. Sometimes they can do it just by moving things from the outside, but other times it's going to require surgery. Okay, so once the bone is all lined up, it needs to be held perfectly still so that whole natural healing process can do its thing. We call this immobilization. And this, of course, is where the classic cast comes in. It basically acts like a rigid external shield. And, not all casts are created equal. You've got the traditional plaster cast, it's heavy, and it can take up to 3 days to fully dry. But then you've got modern fiberglass casts. They're way lighter, more durable, water resistant, and get this, they can be ready to go in as little as 30 minutes. So, the bone is aligned, the cast is on, and the body's internal maintenance crew is working overtime. So, now what? The journey's not over yet. In fact, this is where the patient starts to play a really critical role. And that brings us to the final and maybe the most personal part of the journey, recovery. This is where your actions can directly impact how well and how quickly you heal. Living with a cast has a few key rules. You've got to keep it dry. That's a big one, especially with plaster. Elevating your arm or leg really helps with the swelling. And I know it's tempting, but no matter how much it itches, you can't stick anything down inside the cast. You could break the skin and get a really nasty infection. It's also super important to watch for some serious warning signs. Nurses often use the 5 Ps to check for a dangerous complication. So if you feel severe pain that just won't go away, if your skin looks pale, if you can't find a pulse, or if you have numbness or can't move your fingers or toes, that's an emergency. You need to get help right away. And finally, after that cast comes off, the work still isn't done. Your muscles will have gotten pretty weak from not being used, so physical therapy is almost always needed to rebuild that strength. And things like crutches or a walker can help you get moving again safely, putting just enough stress on the bone to help finish that final remodeling phase. And that brings our entire journey full circle, doesn't it? We started by learning that bones are living, constantly changing organs. They're not just there, they're actively maintaining and rebuilding themselves every single day of your life. So I guess the question to leave you with is this. Knowing you have this incredible, living framework inside you, what are you going to do today to support it?